This project is called The Scope of Practice for the Canadian Chiropractor. The project was put together in collaboration with Brydges, Dan Dow, Logan Gerwing, and Thomas Johnson for the final CP 1101 assignment, due May 16th. According to the World Federation of Chiropractic, there are 88 countries with voting members representing chiropractic internationally as doctors of chiropractic recognized as spinal health care experts. The scopes of practice, model of care, status, and even the vision for the profession differs from place to place. Today, we will be focusing on these aspects at home here in Canada. Almost 2 million people utilize chiropractic services for a variety of issues involving pain, dysfunction, wellness, nutrition, and other factors. With focus in Ontario, we must establish what the CCO, College of Chiropractors of Ontario, recognizes as our scope of practice. It includes the assessment of conditions related to the spine, nervous system, and joints, the diagnosis, prevention, and treatment, and primarily by the adjustment of functions of the spine and the effects of those on the nervous system. And finally, the dysfunctions or disorders arising from the structures or functions of the joints. So what does this really mean to the public? What does it mean to the practicing chiropractor, and what does it mean to other providers of care? Medical terminology and scopes of practice become confusing to those in the public eye, and how can we help them if they do not fully understand what we do exactly? We first must establish our role. We are providers of care, and the public must be well informed of the role in which we provide in their healthcare. Treatment will be based on the chiropractic model of healthcare, including 7 very important things. First, chiropractic care is directed towards enabling the restoration and enhancement of health by the patient by altering neural regulation of the body systems through the MSK system. Chiropractic care is directed toward the body as a whole, learning about the patient's overall health, support systems, and not only their basic complaint, but viewing each patient as an individual entity. Chiropractic care emphasizes natural and conservative therapies. As such, we are drugless practitioners, and chiropractors will use their knowledge in manual and non-invasive therapies to treat musculoskeletal MSK-related conditions. Chiropractic care embraces therapeutic, rehabilitative, and preventative measures, whether it's helping someone recover from a motor vehicle accident, providing preventative measures and care to someone with posture complaints at work, or treating a child with a sports injury. Chiropractic doctors will look at these 3 important aspects of care. The chiropractic patient encounter places importance on educating a patient and the understanding of his or her health in order to make beneficial decisions in the future. Education is very important in helping a patient in the long term. The chiropractic model of care reflects a philosophy of healthy living, particularly by example both for individuals and the community. The model of care recognizes that the individual has an active role to play in his or her health, and a cooperative relationship between a chiropractor and a patient is greatly emphasized. Chiropractic care under these scopes of practice and treatment models demonstrate a significant role and contribution that we have in the healthcare system. For a long time, the medical profession has always clashed against the chiropractic profession. We must be cautious when treading into mainstream healthcare and medicine. As such, this carries us to the next important point of contention, the strength of evidence and the identity of the chiropractor. Neuromusculoskeletal conditions are what Canadian chiropractors focus on. Over decades of hardship and battling into gaining acceptance, we now deliver many different modes of care compared to our predecessors, now involving not only spinal and joint manipulation, but also soft tissue and myofascial muscle release, exercise prescription, rehabilitation, different modalities, nutritional advice, and expanding our role in healthcare education. We have deviated away greatly from visceral or organ dysfunctions, becoming more focused on a biomechanical pain-based model. The strength of evidence comes from 3 main sources. It relies heavily on research, patient satisfaction, and the continuous and strenuous training and education of our chiropractors. By the way, this has led to tremendous and successful research in the field. Research involving non-surgical care and or conservative treatment exhaustions such as Dr. Oliphant's review on lumbar disc herniation emphasized that a risk of only 1 in 4 million of having complications with manual soft tissue care. The Neck Pain Task Force indicates no correlation between vertebral artery dissection and manipulation or mobilization. There are greater risks involving non-steroidal, non-anti-inflammatory drugs for pain relief. Costly economic use of healthcare dollars due to unnecessary patient visits are on the rise for back-related pain, and costly use of diagnostic imaging including MRI, X-rays, and CT scans are also on the rise. In fact, there is an overwhelming amount of evidence, research, and studies conducted by renowned researchers across the country, which in turn will strengthen the support for the chiropractic profession. These are clear indicators needed in order to have the chiropractic care move forward and make strides into the areas of mainstream medicine. To recap so far, we have tackled some key issues including the scopes of practice, strength of evidence, and the importance of research in establishing chiropractic into the medical community. This has nicely led us into our next topic involving interprofessional concerns. It is important to keep in mind that just decades ago, the idea, science, and philosophy of chiropractic were so ill regarded by the medical community and other health practices that took a long time to rebuild. Both Canadian and American medical associations fought long and hard to bring down their respective chiropractic associations. In spite of further advances, interprofessional boundaries still exist today. They include knowledge, communication, biases, geographic constraints, and economic constraints. The lack of knowledge and understanding for the profession makes it tougher to make grounds with other important providers such as medical doctors, physiotherapists, orthopedic surgeons, occupational therapists, massage therapists, and other providers who can play a positive role in a patient's health and well-being. And the biases exist against alternative medicine, while geographic and economic considerations are looked upon as losing patients to another provider. Close to 8% of chiropractors reported that they have never sent a case report when referring a patient to another chiropractor. 13% never sent a case report to a medical doctor. And 10% of chiropractors never sent follow-up clinical information to medical doctor referrals. Chiropractors who perform differential diagnoses were significantly more likely to have engaged in interprofessional referral than chiropractors who did not perform differentials at all. These are important communication practices which can enhance interprofessional relations. We must examine the relationship between orthopedic surgeons and chiropractors. A cross-sectional survey taken across North American orthopedic surgeons as to how they perceive chiropractors, and the study revealed that the variability among chiropractors include limitations such as chiropractic treatment, areas where they were perceived as effective, unethical behavior, patient interaction, scientific basis of chiropractic, and chiropractic training. There was much criticism over treatment of non-musculoskeletal complaints. The study gives insight to where our profession is lacking, where we can improve, and what we've been doing right so far. And finally, chiropractors of the future will have many things to look forward to. Practice styles and formats for opportunities for chiropractors have evolved greatly since the start of chiropractic. Although our identity has been a challenge to find, it is coming together positively. And because of the strength of our advocates and those currently in research and clinical practice, opportunities that we've never seen before have become real possibilities, including multidisciplinary clinic settings, hospital integration such as that of Dr. Kopansky's into St. Michael's Hospital, possibilities of playing the role in orthopedic referrals. We can also continue to treat within individual clinics, become pre- and post-surgical preparation rehabilitation roles, and of course, further integrated interprofessional care is highly important in becoming more patient-based than practitioner-based. So what does this all mean? Millions of chiropractors coming from all sorts of different backgrounds, color, and sizes, young or old, athletes, mothers-to-be, families, pre- and post-surgical candidates, students, kids, and any other individuals who can seek chiropractic care directly and know what kind of treatment they are receiving. Chiropractic associations across the country are aiming to expand the knowledge of chiropractic, scopes of practice of the typical Canadian chiropractor, and the conditions which we treat help us identify ourselves as a proud Canadian chiropractor.